And what is breast cancer? So basically it's cancer that affects the breast tissues. And when we say cancer, cancer is just an abnormal growth in cells. So normally your cells should grow and stop dividing and multiply at a particular rate. But in breast cancer, this mechanism is inhibited. It's not really working so they're just growing, and then they're causing all kinds of problems. Breast cancer is also, if you don't examine your breast on a regular basis, you don't know you may have it. A lot of people are not aware that they have it. They're walking around with lumps in their breasts, or they're having discharges and they keep on ignoring them. So at least by watching this video, you know what to look out for, some of the signs and symptoms to look out for when you have breast cancer, so that you don't have to wait until the end before it's picked up. Because the earlier it's picked up, the better your chances of survival. Remember that early detection is key. So how do you know you have breast cancer? Firstly, it's by doing regular monthly examinations. As a woman, you should examine your breast by yourself every single month. If you don't know how to do it, make sure you learn how to do it. Okay. It's a very simple process. Just takes about a minute or two. But you're looking out for lumps, any change in size or shape of the breast. You're looking out for the nipples. Ideally, the normal nipple should be standing outside. It shouldn't be going inside. If it goes inside, we call that nipple invasion, and that's not normal. Unless you are born with it. Some people are born with nipples inside or flattened nipples. Now you can't do anything about it. But if you're not born with it, you hand it out and you suddenly see that it starts to go in, you have to get worried. When your skin starts to change color, so you see this orange peel appearance on your skin, then you have to get worried, because the breast shouldn't have any pattern or any texture, different texture. It should be like a normal texture, like the way it always is when you touch it. So we're looking out for all those things. And breast cancer affects both men and women. Even though in men it's just 1%, I mean, it still kills them and it's quite aggressive in them. So I'd encourage the men as well to examine their breast. Every 2 to 3 years is fine. With the woman, if you're under 40, you can do it every 3 years. But if you're over 40, at least every year, an expert should check it for you. And you should also be doing your mammograms as well. So over 40, make sure you're doing your mammograms on a regular basis. If you're under 40, you can do the breast ultrasound scan. In case your hands may have missed any lumps or anything, the scans, the mammograms pick all these things up for you, so that we can tell whether there's something going on, and that we can treat it for you effectively. So those are a few signs and symptoms. Bloody nipple discharge as well is also one